Good evening, everyone. A warm welcome for this edition of Diabetes Bytes, organized through our organization RSSDI Central Chapter. And I am Dr. Sreenivasa Murthy, who is the Vice President of RSSDI currently. Today, we'll be talking about health of the healer, and that's the title of the topic today, and that revolves around the physician's, clinician's health. I'm sure all of you will agree that the health of every individual is important, and more so the importance of the medical fraternity, which all of us realized during the COVID pandemic, that the health and of the healer is supposed to be very, very important. And to discuss this and also to give you insights about this, today we have two eminent faculties with us. One is Professor Anubha Srivastava, my colleague. She is working as a professor at MLN Medical College and looks after the endocrinology department. And we have Dr. Shashikant Kumbar, who is one of the persons who has done MBBS and MD in yoga. He's one of the first guys in the country who's done MD in yoga. And that's something which is going to give his perspective regarding the importance of yoga in mind-body maintenance, and especially for the treating doctors like us. So, to tell you that the burnout, physician burnout, what we call, is a big problem across the globe, not only in our country, and especially this worsened after the pandemic. So to look at the feel of it, we did through our American College of Physicians chapter, we did a simple questionnaire where myself, Dr. Anubha, and Dr. Anuj Maheshwari sir were part of that designing, and we looked at about the questionnaires to look at the burnout among the doctors. So let's get the feel of that survey. Dr. Anubha, can you tell us, among the doctors, what was the prevalence? Was there any age predilection, sex predilection, or working class like juniors, seniors? Did it matter in your survey?
Yeah. Thank you, Dr. Srinivas. It's a very pertinent topic to be discussed, and I'm thankful to RSSDI for taking it so keenly. And as Dr. Srinivas is talking about one of our survey, this survey was conducted under the American College of Physicians under leadership of Dr. Anuj Maheshwari sir, who is our governor. And we, with the insight, what we wanted to look, especially the post-pandemic, the mental and the physical conditions, health condition of our doctors. So we designed a study of around 800 doctors we were able to rope in. What we were able to find during the survey, the majority of the patients, the doctors who responded were internal medicine specialists, around 36%. And what results of the study, as he was asking about the prevalence, around 50% of the individuals report, it was a self-assessment questionnaire, which reported burnout at some of the points. We actually used a Copenhagen burnout inventory where we assessed the personal burnout, which was the effect on the physical and the mental health, which was not associated with the patient care. Then we looked about the patient-related care, patient-related workout, where we were genuinely, it is the patient's care which is creating a burnout. So we found that most of around 50% had burnouts in either of the three domains, and around all the three was around 25%. The things to be considered or worrisome which came out in our studies was our younger younger doctors, the ones who are working as a postgraduate and the undergraduate student who are less than 2 years, who have joined the medical fraternity. We're actually having more burnout on all the three scales. There are various reasons, because they are just starting over of their careers. The work-life balance is still difficult to achieve. Maybe the causes. Yes, the females, we definitely agree, as the study showed, had a greater brunt for the burnout. And I just talked about the younger individuals, which were showing a higher scale of burnout in our study, as we have the demographic profiles.
Right. So thank you very much. The other point we were eager to know is any social habits associated with the burnout did you notice among the fraternity, doctors fraternity?
Yeah. We found out that 83% were non-smokers and most of them were only social drinkers. So that was the reports which was found in the study. But
So
when we
what we
compared,
preach, we are
but
following.
we hope so. So
Yeah.
what we actually found that the ones who were smoking, that 17%, they had more burnout rather than the ones which were non-smokers. And I'll take the diet and exercise also into the social habits. So the exercise, not many of us are actually doing regular exercise. It was just an exercise rather than and the duration of exercise. What we found that only 40% of us are working of or more around 30 minutes, and this was having a statistical significance in the burnout. The ones who are exercising are definitely having less burnout as compared to the non-exercisers. So
Great. So
this
the
was,
message is very clear, whether it's
yeah.
patients or doctors, the exercise definitely helps. Now, let us bring in Dr. Shashikant, our yoga master today, who is a qualified uh, person to talk about this. Does yoga complement alternative medicine therapy for wellness? This holds good for both patients and for doctors, Dr. Shashi, what I'm asking. And can yoga be helpful in reducing this burnout? We are talking about the physician burnout, the clinician's burnout. Does it help? Can you please throw some light on this?
Yes, sir. Thank you for the invitation, and it's a wonderful gathering, Sreenivasa sir and ma'am. Uh,
Yeah.
I'd like to quote one of the research, one of the long-term survey they have quoted. They noted down that the emergency medical doctor's average lifespan was 58 years. Just find out this, and the general physician was 80 years. So this was the long-term study survey of the finding out the specialty of the doctor who have
Yeah.
passed away in that particular institution. So it shows very clearly shows there is a substantial you know physicians burnout exists, which is absolutely hidden because most of us will say, hey, I am a doctor, and even in terms of cancer also, most of the doctors who suffer from cancer, any of the cancers, they won't complete any of the long term and chemotherapy and other medications. So with that statistics, what I would like to say is, compared to the general public, the hari vari kari, whatever we used to hear that exists in the general public, and you see the non-communicable disease statistics, we as a doctors, we have a much more level of stress, which is like a tip of the iceberg. If we really evaluate from the questionnaire based study, we could do much more in this. So I made a small module for all the doctors. Is like working on the left nostril breathing and Jacobson's progressive muscular relaxation technique. So just as a gift to all the physicians, whenever they have time, 5 minutes, 10 minutes, 15 minutes, 20 minutes, they can adopt this. It will build a
Breathing
coping
exercise.
skill.
Yeah.
Yeah, it will build a coping skill for a doctor to face the situation, and it will also long-term yoga practice also increases the gray matter of the brain to endothelial release of nitric oxide and all whatnot. If we can add just 5 minutes to 20 minutes in our daily life, it would be better for physicians.
Can you
Uh,
please tell this technique, Shashi?
uh, One thing I would like to pitch in between, actually, as Dr. Shashikant pointed about the emergency department, in our study also we saw those who are working more than 12 hours a day,
The
or
duration.
they have
Duration was
duration,
related.
even the
Yes.
night duties, more than
Yes.
3 shifts night, they showed a higher burnout. So we very well agree the emergency doctors are definitely at a higher rate of brunt, and I think yoga is one of the coping mechanisms which we can learn from you.
And easily be practiced. See, that's the best part
Yeah.
about yoga. What I have found is, irrespective of your travel, which country, which place, all that, you can still do your routine on everyday mornings or evenings as per your schedule. Shashi, can you please tell us about the technique? You said 5 minutes also we can practice. Even in our busy OPDs, maybe we can take a break whenever we are stressed out. It will be,
Yes,
I think,
sir.
much helpful for everybody.
Yes, sir. I'd like to add one point for the doctors to feel about yoga is we have all the sorts of exercise in the world. Yoga is the only exercise which also works on the smooth muscles. Believe it or not, most of the exercise, aerobic, anaerobic, isometric, isotonic, whatever gravity, anti-gravity, agonist, antagonist, whatever way of exercise strength building, agility building, dexterity building, whatever you can add. So yoga works on the smooth muscles also by working on the kriyas. But only problem nowadays generation is it is too much of yoga everywhere. Non-medical people are starting, Array, I'll cure the disease. There is an anti-allopathy propaganda everywhere. Yoga is seen as a tool, best tool to use it as against the doctors. Array, us doctor ke paas mat jao, mere yoga aa jao. No. So there should be best combination of complementary, medicine along with the conventional medicine. We should choose that middle part of that thin line of integrative medicine.
Yeah, this is
So
actually a public forum, Dr. Saab. So we would like you to elaborate more that this is a
Scientific way.
continuum of medical
yeah,
treatment only. It is
Exactly.
just
And it's a
not an
scientific.
allied. Yeah.
sure, sure. So it is a holistic, simple holistic approach where what I use in my case is simple, coherent breathing technique of the West is the Nadi Shodhana Pranayama of the East. So simple nostril breathing, I make the person focus their mind onto the breathing. So by that, number of thoughts at the background will reduce. Number of the thoughts reduces, sympathetic overactivity reduces. Sympathetic overactivity reduces, stress response reduces. Stress response reduces, you can prevent most of the NCDs, non-communicable diseases, which you can find out in the statistics. So it will be helpful in that.
Great to know that. And also, it's very important that Dr. Shashikant has pointed out that this is the only method of exercise which can influence your smooth muscles, which we commonly teach as involuntary. It's not under our control. But in spite of that, this can be controlled, and that's proven. And Dr. Shashikant is a specialist who can relate this medical to the yoga. That is what is the best part about him. Now, let's move on to the next question. I think that's very important, pertinent again to Dr. Shashikant. Can you tell us principles of yoga and yoga sutra? This applies for everybody. I mean, this is a public forum, as we said rightly, and RSSDI is the largest organization for diabetes professionals in the country, in Asia, I would say. And this is to tell and help our patients and doctor community to cope up with their stress. And that is the motto of this today's Diabetes Bytes. And Dr. Shashikant, can you please tell us about the yoga and yoga sutras?
Yes, sir. So it is a huge topic. If I have to share it in few minutes, what I can share is, if you compare worldwide the working on the mind, like psychology or psychotherapy, neuro-linguistic programming, hypnotherapy, whatever you consider, less than 400 years. So recently we are calling it as a mind-body medicine, integrative medicine, family medicine. But in Yoga Sutra, I consider Yoga Sutra simplest. I'll give you one sentence wow factor feeling that you'll go and search 100 times and you'll still feel wow. So Yoga Sutra is the only Indian text about the Indian psychology where it tells more about the mind and the modification of the mind. So Chitta Vritti Nirodha, mental modification, if you can work on the cognitive overload or sensory overload, what you create normally in the conscious mind, that can be subdued and worked upon. So when the conscious mind is worked upon and better, because most of us are only working on the conscious mind sense, five senses, conscious mind. We usually do not explore the subtle aspect of the subconscious mind. So if I can say yoga can be used as a subconscious mind training tool, so it will be one of the best module. So I'll give an example of Dr. Tony Nadir. You need to note down this. Tony Nadir has done a workup on the Patanjali Yoga Sutra. He correlated all the 194 or 193 sutras to 4 lobes of the brain. So 4 padas of Patanjali Yoga Sutra compared with the 4 lobes of the brain, and the number of Salkai and Gairai, he correlated with one of the sutras. So each sutra. So that is very fantastic research, and he published it. So he became the successor of transcendental meditation. He was a MBBS MD into brainwave studies. So he was awarded as a King Adi Raja Maharaja now, and for his research he was awarded 90 kg gold. So beauty of this modern medical science is it will give you the exact reductionist tool to unlock the potentials of subconscious mind. If we can use it for the best, I think we can be the world leaders in bringing out the modules which can help uh, the people worldwide, because we understand the normal psychology much better, and added onto that the super specialty or multidisciplinary approach is added with that, it will become the best zone to work upon.
Thank you, Dr. Shashikant. Can you just emphasize the effect of yoga on mental and physical well-being together, and what are the things you should practice? What kind of asanas in general? Just I know it's a huge topic by itself, but just to for our listeners and for the doctors who have joined in, just about the effect on the mental and physical well-being, because these both of us. I mean, as a professionals, all of us undergo this, the physical fitness part. Lot of doctors do not follow the exercise pattern because they don't have time. That's the commonest excuse, most of us, and what we preach many of us don't practice. So that's the point. So can you help us on this aspect, Dr. Shashi?
Yes, sir. Sir, simple tools of a breathing technique, because if I say whoever is breathing is doing yoga, then everybody is doing yoga. So if we can work upon, say, if we are having an anger issues, there is a fast breathing. If you are very calm and relaxed, our breathing is also relaxed. So I use the breathing as a tool to work upon the mind. So equal pattern of breathing. So classically Nadi Shodhana Pranayama or Chandra Viloma Pranayama is used. So in my case, I use 4 seconds breathing in, 4 seconds holding the breath, 4 seconds exhalation, and using some part of mudras where person can dissociate his mind or her mind to a neutral object for some time, either it is a breathing or a blood circulation. At that time, their number of thoughts are reduced, and this will give them connectivity between the body and mind. Once the body and mind connectivity is established, body goes into a phase of parasympathetic dominance, which will help us for relaxation and rejuvenation. To start with, simple, you are doing shavasana for 10 minutes, that itself is enough, and simple breathing technique would be more than enough to start with. Once you are inclined, interested, we can explore much more further into it.
Yeah.
So there are 84 lakhs of asanas. So
84
all those
lakhs.
asanas, 84 lakhs of asanas, and on
Okay.
an average 650 skeletal muscles. Think of permutation combination. What many physiotherapy exercises, therapeutic exercises you can design it.
Yeah. Actually, as you said, the vagal tone reduces once you are doing the breathing exercises, and definitely this is so much helpful. The reduction in the blood pressure, the reduction in the pulse rate. It is helpful in most of our non-communicable disease, diabetes, and its comorbidities being one amongst them. So this is not only giving you mental peace or reducing anxiety or creating a well-being, a sense of well-being, but also relating to our physical health also.
I
I
think
think there are
that's
some
very good.
asanas for diabetes also, mudras or
Lately,
asanas linked with diabetes.
there are, I think, recently there are some 2-3 publications I saw, which they mentioned specifically 4 asanas.
Yeah.
I might remember few of them: Vakrasana, Matsyendrasana, and Hamsasana, and the other one which I don't remember. They specifically found out that these 4 asanas are little better in reduction of blood sugar compared to few other asanas. Maybe they say that they projected that there is a stimulation of intra-abdominal pressure changes, so the vagal tone changes, and indirectly the again coming back to the relaxation response. So the relaxation response helps us to again work on this. So one more research says that your cingulate gyrus or your thalamic relay station, the size of thalamic relay station increases because the neuronal connectivity increases, and gray matter thickness increases, GABA level increases. So this itself is the research tool, not my research. It's already done research. This itself says that yoga has something to do with the health. So that's why it is relevant till today in the generation of this modern generation. If still yoga is relevant, means there is something about it. Only in our tool, institutions like this, Srinivas and team, our ideas is you are the best of the multidisciplinary knowledge. When they approve this kind of techniques with an evidence based, other people will accept much better rather than just saying, "Arey, go and do yoga." No, if you can make us a few protocols and give it to them, so that will be a greatest gift of Indian doctors to the world.
Yeah.
Completely.
One
Yeah,
thing we
Anubha.
found in our study also, that sleep, majority of the all the components of sleep, the quality of sleep, the early morning awakening, the I should say the quality and the content of this, all parameters were affected when we checked with our doctors. So this. Can this yoga being one of the measures or tool for mental wellness, do this also helps us to have, like, once a person is doing regular exercise, breathing exercises, yogic mudras, this helps in the sleep also.
Yeah, of course. Again, studies. I think you are asking questions which I was prepared for it. Studies shows that deep sleep cycle increases. For the people who are long-term yoga practitioners, more than 3 years, people who are doing yoga practice for more than 3 years, their quality of sleep, the duration reduces, quality increases. This is the study
Yeah.
outcome, where they
Great.
say that there is one more hypothesis we can say. So most of the time we are using the prefrontal cortex, which has a seat of fear and anxiety, stress, emotions. When people are doing certain yoga postures, yoga practices, there is other part of the, like ventral stratum, cingulate gyrus, other part of the brains are activated. Dopamine secretion is different. Frontal lobe functioning towards the stress response is less. So that's exactly we can show it in a functional brain MRI. For the people who question it, or we should not accept anything blindly. At the same time, we should accept everything with an evidence, little evidence, or at least hypothesis. So we can definitely add much value to this in terms of preventive medicine or integrative medicine concept.
True. I think that's a good thing about Dr. Shashikant. He always speaks with the scientific evidence, which most of them don't talk. They say yoga has been surviving from so many centuries. That's why it's good, all that. But now we are having evidence, which is literally seen, done in various studies and showing the benefits. And that's the best part about it. Anubha, in your study, what were the methods the physicians were looking out for stress relieving or stress busters?
Yeah, we were talking about one of the measures which we have taken as physical activities, and yoga being today what we discussed, because we have eminent expert with us. So we went into the length and depth in a scientific way. The questionnaire covered the leisure activities, watching TV, me time, actually I should say, for the doctors, reading, painting, some are in music. If we say the statistical significance, this was the questionnaire which we prepared, that what majority of people like doing in their free time, or what they find stress reliever when they are exhausted or burnt out, they feel burnt out. So what we found was spending time with family and friends, going on vacation with family and friends was significantly affected the burnout level. Exactly, it reduced the burnout. Having more than two vacations a year reduced the burnout. And so this was the coping mechanism, I should say. We need to have some other like the dietary restrictions, the more emphasis on exercise, or inclination to other hobbies, I should say, which should be there. And actually, health wellness should be a capsule For the doctors, it should be like a pill where we as a doctors, we write 1, 2, 3, 4. So for us also, when we talk about wellness, so we should have like a good and a healthy diet, what we advise to our patients, a regular physical enhancement of physical activities, maybe walk can do, it can be sports activity which we can indulge. Yoga, definitely I'll vouch for the yoga anytime, and I think Dr. Srinivas will agree with me also. Then we can add upon investing in our hobbies, having some me time may definitely help to reduce our burnout. And I think Dr. Srinivas should add on some more.
Yeah, I think your
himself
exercise pill is not well digested by our colleagues, I'm sure, because they don't like the advices when it's in a healthier way. I think the primary prevention part, most of us don't take care. I think that's the message, clear-cut message. And any last question you want to ask, Anubha, to Dr. Shashikant? Of course, Dr. Shashikant will be there in future programs. I can promise you, assure you that it will be an elaborate program, and also through RSSDI, we will definitely plan much more yoga in a scientific way, because we strongly believe it's a part of our not only our culture but also part of our treatment as an ally to our allopathy treatment, which can help our patients to get rid of the complications and have for example, the sympathetic overtone can be reduced. That itself, the stress levels itself, can modify a lot of disease manifestations in various ways, and that's something which you should adopt. And not only yoga, any form of exercise will help any diabetic at any point of time. So that's something all of us should practice, and what we practice should preach. And we got a lot of comments from our colleagues, thanks to them, that they recognized that the topic of today was something very different, because it was about the doctors and their quality of life, especially the physical fitness and the mental well-being, what we were talking about today. And Anubha, anything you want to ask? Anything?
We need everyone to emphasize on self-care. We need to heal the healers. We need more people to acknowledge that we ourselves, we are the first to take care. It's our duty to first take care of ourselves also.
Yeah, I think the work-life balance is something we should do, and now it's time for that. I think all of us should go back to our families, and that's one of the stress busters we have in our daily routine. So I sincerely thank Dr. Shashikant for
I think
joining in a short
Dr. Purvi
notice.
has joined.
Yeah. I'll hand over to her. And hand over to her. And Purvi literally taking care of her health today for a change. Otherwise, she's always busy in doing the programs, running around across the country, across the globe. And
So
Dr.
we are
Purvi,
there
over to
for
you.
we are having your back. We have to have each other's back.
Yes.
Well said, I must say. But I have one question for Dr. LSM, sir. Sir, how do
Yeah.
you really manage, your multiple activities? You're always at the forefront of everything,
Yeah,
and
I
that's
can
pretty
easily.
much true for Dr. Anubha also.
I practice yoga every day. That's one of the secrets which many of my friends also do not know. That's one of the things which has changed my lifestyle, I would say. And I've been really happy practicing it every day. It's like, it's become part of life. And definitely it has changed a lot of things. And of course, other one is the time management, which we have learned over a period of time. And what we preach, we should try to practice. That's what I try to do. Many of the things, I think that's what is the secret. There's nothing, rocket science in that, but yoga definitely has helped personally to me. That much I can vouch and tell. I think Shashikant will be very happy to hear that.
Yeah, ma'am.
Yes, sir. Of course,
Actually,
sir.
Excellent.
yeah,
I
we
think you
doing.
really said it.
Yeah, we
Go
all
ahead,
Yeah,
need to
Dr.
Purvi.
start.
Shashikant.
Yeah.
Dr. Shashikant, any final message to our patients and our colleagues, doctors?
Yes, sir. I think with your team, I think we can do a lot of activities. So I can only promise that it is like I took a retirement after studying all. I took a retirement. I am available if any chance is given to prove a protocol for especially diabetes patients or doctors. Especially, I would like to say that most of us doctors work on the physical body. So when the patients are sitting in a waiting for a doctor, why can't we give a specific questionnaire and pre and post. See that like hospital anxiety depression scale or general health questionnaire or Epworthy's sleepiness scale, or some of them perceived stress scale, subjective well-being inventory. Some of them, give it to them, give some module which we can design and give maybe 45 minutes or so, and ask them to practice for about 40 days or something like that, and then compare pre and post in your own place. You can prove that so this works for you, and we can publish one or two research articles. Now, that
Definitely,
is
Shikant. I think I'll put
my
forward, if you can please design a small study kind of prototype. Our President Dr. Brijmakar sir will be very happy to endorse these kind of things and encourage. He's always there. Dr. Sanjay Agarwal and our EC members will be very eager to do such things, which will help our patients eventually. And that's the goal motto of our RSSDI basically. And this is one of the segments where we are trying to educate our patients and to help them in their daily routine, apart from their own doctors, whatever they are undergoing treatment. This Diabetes Bytes has been running so successfully because of this. And of course, the backbone is Dr. Purvi. For this, I should appreciate. She's so sincere that every week it ensures every Thursday it is aired and between 7:30 to 8. And that's the best part of it. Which episode is this, Purvi? Episode number?
So we have actually lost count of the episode number because we did a lot. We are definitely more than 120
It's more than
episodes.
120 exactly, and it's every week. That's the best part. Every week.
Last 3 years it's been running successfully thanks to experts like you all, because you make it a point to actually dive into your busy schedule and still be there for RSSDI whenever we request you, and then conduct such important sessions. So it's kudos to you all, and really a big heartfelt thanks. I don't think RSSDI is yours, sir. So for me to extend a heartfelt thanks is sort of awkward, but I'll still give that on behalf of our president, Dr. Makar sir, Dr. Sanjay Agrawal sir, who's our secretary, and the entire executive committee also for this special session, which has been an eye opener for many of us. I think we just by nature we have become workaholics, and it's time to sort of break and apply those breaks and definitely not learn the hard way and focus on some private.
I'll add, ma'am, our professional
Yeah,
commitment. Yeah, we just need to add one thing. The way the professional commitment we just have to make a personal commitment, and it will do wonders.
Exactly.
Absolutely. Very well said. And a big thank you to our, first time guest, Dr. Shashikant Kumbar. And I'm sure we will be working with you, sir, closely. Like Dr. LSM, sir, also said. A very big heartfelt thanks to all three of you for making this episode so interesting and so worthwhile.
Thank you, ma'am, for inviting us.
Thank you, Dr. Shashi, again. And thanks, Dr. Anubha, for being always there. And good night, everyone. Please take care and reach out to RSSDI at any point of time through the contacts we've been scrolling. We will be very happy to assist you at any point of time. Thank you very much, and good night, and stay safe.
Absolutely.
Thank you.
COVID safe. There are alerts. So let's be watchful. Thank you. Thank you again.
Thank you, everyone. Good night.
Thank you.